Hey, so today we're going to go over the rapid infuser setup. When you pull it out of OR2, it's going to have a bag with everything that you need to set up your line. You're going to have your 3-liter reservoir. You're going to have the tubing that goes into the unit, and then you're going to have the extension tubing that goes to the patient. Now when you open up your line, it's going to have a small filter on it already. We do not use that. We prefer to use the 3-liter, so I'll show you how to switch that out. Okay? So when you open that package, your tubing is going to have a small filter on it. Right away, just take it off. There's a lure lock here, and you're just going to discard this. We don't use it. You're going to take your 3-liter, and you're going to go ahead and attach that to your tubing. Okay. On the top, you've got 3 ports. You have 2 double lumen adapters and 1 single. So you can attach 5 bags of fluid to this 3-liter reservoir. Okay, once you have it set up, you can go ahead and begin to set up your actual pump. Okay, when you first get into the OR, you're going to want to plug it in. It will work without having battery, but it will not warm your fluid. So go ahead and plug it in. You open this here. You're going to take your reservoir and set it in here so that you can then go ahead and set your tubing up. You're going to start with the warming ring. It's going to go right in here. Okay, and then you're just going to follow the colors. This is the air detector, and your tubing is just going to sit right along here. Okay, you have your air in, air out, and your fluid in. Now, this little thing sits on this ledge so that this is flush. Okay, once you have all of your tubing in the right place, you can go ahead and close your system here. You're going to attach your extension to the tubing here, and then now you're ready to start. When you use hanging fluid, you need to remember that we use only sodium chloride, normal saline, while hanging blood, no LR. This also has a little cheat sheet here about what goes into the rapid infuser. FFP, RBC, normal saline, albumin, head starch, those are all okay. We don't do platelets, we don't do cryo, they cannot be warmed. We don't hang LR with blood or use half or 3% NS or anything with sodium bicarb, calcium, or dextrose in it. Okay, this hangs here on the rapid infuser should you have any questions. Okay, so you're going to go ahead and I just tend to use the single spike for my saline. Make sure that the rest of your lines are all clamped off, and you can go ahead and spike this bag. You don't want to fill this whole reservoir with saline. You're trying to give blood to your patient. You don't want to dilute it with a bunch of saline. So usually I just fill it with about 200. This whole system here inside takes 100 mLs of fluid. So I just usually put 200 just to have some extra for your patient line and that you don't run dry. So you can go ahead and unclamp, and as you're doing that, you turn on the machine in the back. You want to push it all the way. It kind of has a stutter step here where it kind of starts to turn on. You think you're done, but you have to push it all the way until it stays on here. Okay, and this is pretty self-explanatory. It tells you what to do and when to do it. Okay, I've gone ahead and clamped my line here. I've got about 200 mLs in the reservoir, and it says prime. So you go ahead and hit the prime button, and it tells you how many mLs you have to go. Something else must be clamped because it wasn't wanting to continue. See, now you're seeing that the numbers count down as to how many mLs you have to go in your priming of the internal system. Okay, now it's all set. It says prime your patient line. You can just hit this once to prime it, or if you want to go a little faster, you can hold it down to go faster to prime your patient line. What is it saying? Okay. The mute button is very important. It says high pressure detected. That's because this isn't actually on a patient and I have this cap on here. So I'm going to loosen that. I'm going to hit next, and we're going to try again. Prime the patient line. It's clamped right here. So it tells you exactly what it needs as you're doing things. And that mute button is really important because it's hard to think when it's yelling at you. So remember that mute button. Okay, now you can hit infuse. When you're ready to infuse blood to your patient, you're going to hit infuse. You have some options here. You can do a bolus. You have your really quick 500 mils per minute, which is our max. As you're going, you can see the temperature is beginning to rise. And we're just going to go ahead and hit this to start infusing. Now it's going to sense the pressure that's in the line. So it might not go quickly to 500 mils a minute if there's more pressure in the line. It will begin to tell you when there's too much pressure, and then you can slow your rate down. So as it is, like we said, we had that cap on the end of that line, so your pressure is pretty high in the line, so it's only going to go at 215 mils per minute. But if you think about it, that's pretty quick. That's a liter in like, what, 4 minutes? So you can change your rate here by holding down. It goes faster to slow your rate. You can also increase your rate here. And as you see, the temperature continues to raise. Like I said, if it's not plugged in, it will not heat your fluid. So please remember to plug your rapid infuser into the wall power. Here's a running total of the volume that has been given to the patient. And if for some reason you need to recirculate the system, you can hit this, recirculate, that kind of make sure that this line, it stops flowing to the patient, and make sure that your line has no air in it, and you're good to go here. When you're ready to stop, you just hit that stop button.